to the hospital, the doctor will say, take this one, and they know one which takes a shorter time. They choose to medicate themselves with the what?
Basically those, but there's also a tendency of Dr. Google. Eh? So some of us, you put into Dr. Google, you search, you say, headache, this, which drugs can help me manage the symptoms? So Google brings you a list of medicines that can help you relieve those symptoms. So you walk to a nearby pharmacy and you say, medicine A, and then that is what you buy. So even when that health professional in that pharmacy tells you otherwise, because you're so convinced that of what you read the other side, you insist on that, and then you go with that. Then I also found out that some of us avoid doctors' consultation fees. So you think, and you're like, even before the doctor writes anything, they're going to charge me 50,000. And yet, in the end, you might find the medicine could be cheaper than 50,000. So you find a shortcut, and you say, no, let me dodge the consultation fees. And then you just walk in and you ask for whatever you think can relieve your symptoms.
For example, knowledge from friends and neighbors. It was discovered that most people, around 28%, choose the medicine they choose because someone told them it will what? It will work. Then, 74% of people, okay, some of you are nice, at least you go to the pharmacy, then you ask the pharmacist, I feel like this and this and this and this. Then from the knowledge that they have given you, you choose that medicine to do what? To treat yourself. So it's like a mini consultation without going into the hospital. Then 50.8% was no episodes. The other time I had diarrhea, I took charcoal. It worked. So this time, because I have diarrhea, I'm also going to take charcoal. And you hope it will work. Unfortunately, that's not how things work all the time. Maybe the other time, the diarrhea was from a bacteria. This time, it could be from an amoeba. You can take a whole strip of charcoal, it won't help. You'll die of dehydration. So, just because it worked last time, is not a guarantee that it's going to work this time. So, then some people, like my friend has said, we go to the internet. Most of us are guilty. In fact, I can go as far as attempting to say all of us Google our symptoms. You Google your symptoms and signs, then Google tells you it could be this or this or this, take this or this or this in these measurements, and you take. Then we've also all had adverts for what? For a headache. As you're driving, the radio is too loud, then the advert comes on. Headaches, and you already have a headache, you just park and buy a what? Headaches. A headache. But we don't know what is causing this what? This headache. So those are some of the reasons we choose the medicines we have chosen to give ourselves to treat our conditions. What about why do you not go to a hospital and choose to self-medicate? Here we've been talking about why you would choose a particular drug, but now we want to know why you choose to treat yourself instead of going to a hospital, for example, or a clinic. Why would you choose to treat yourself instead? Yes, please. She says self-medication is cheap. It's cheaper. Another reason? Yes, please.
Whenever we go to clinics, they just put their cannula, they charge you 200.
So she also thinks it's cheaper to treat yourself than going to get invasive treatments even. So maybe fear of invasive treatments and expensive treatments. Yes, please.
It's convenient. Like the medicine stayed over, so it's available here in the house.
Thank you.
Yes?
It is a convenient way of doing things.
It's easy to access and the quickest because the hospital may be far.
Okay, is the access?
Another reason can be, let me take an example of during COVID time. They used to tell us that if you go to Mulago, you'll not come back. because most people used to die. So I personally, it happened to me. I got COVID, but in the first place, I thought I had developed a condition of ENT. So I had to call a friend to prescribe for me drugs concerning that part. But fortunately, I used the drugs and I got cured, but I didn't go to the hospital.
So fearing the hospital, eh?
It's time saving. I would rather self-medicate than going and lining up for consultation, go to room number 2. So.
Okay.
Mine happened to me. I got flu and I got an infection in my ear. So I went to a certain hospital. They treated me, but it became worse. So I decided to go to Mulago. When I reached there, the doctor said, which person was treating you? This drug, we no longer use it. Now see the condition of the lady. So now I am like, how can I identify someone who is going to treat me better if the other one treated me and the condition worsened? When I went to another doctor, he was like, now these are the kinds of doctors who are killing people. So sometimes we choose like self-medication because it's hard to know the right doctor.
So lack of
sorry
trust
about
in
that.
the healthcare system. That's sorry.
Thank you very much. These days, especially on TikTok, we have doctors, professionals, specialists that go live. So you can join their live, you start asking questions. Inbox, they are answering you. I have this doctor, this. They start answering you. So sometimes you don't need to go to hospital. They are giving you prescription right online.
Okay.
Okay, so the .com.
That's interesting.
Maybe just ask a question. Given the example she has given us, do you regard that as self-medication or not? Eh? Yes, please. Is that self-medication or not? I don't think it is self-medication because we're interacting with
A doctor.
a qualified profession. We are hoping they are qualified anyway. Yes.
The other thing is thinking I know what is the problem. Like I know it's just a headache. So I think I should just get tabs for headache and that's all.
So people know their bodies, eh? They know how they feel and what is paining.
Yes. So you feel that symptoms are easily managed by yourself?
Okay, I also want to contribute something. Why we do self-medication? Through experience as mothers, we have seen that sometimes when you take a child to the hospital, you find that the doctor is giving you a high dose. Okay, how is it called? That strongest medicine. And then after it fails, you see them saying, let's try again the other one. So now, when we look at symptoms, we first say, if it is cough, I will do azithromycin first before I go. And they give me epicephine and all that, and then it fails again. You see? So.
Okay.
Okay. I'm sorry, but when you gave that example, me and my colleague were like, oh dear. Because you want to start with azithromycin, but it's one of the strongest antibiotics. So you like it because it has worked very fast before. But there's a reason it worked very fast. Those are like over third-line drugs. Eh? We don't start with that one. So the cefixime you fear is actually lower than what? Azithromycin. So you see the dangers of self-medication, eh?
Okay.
Yes?
Okay. I don't use tablets. I usually use natural remedies. So I don't know whether I call it self-medication.
It is.
It's been 9 years, and to be sincere with you, every time I get issues, let's say stomach ache, I have a headache, I usually take water, warm water, and then I just continue. Whenever I got things like malaria, what I would usually do that day, I would take a lot of hot water. I take chigaji, aloe vera. I'm being serious with you. And then that day I would cover myself with a very big blanket and make sure that I sweat. And when I sweat, I always get better. And another thing is never to stay in bed. Whenever you stay in bed, you get worse and worse. So whenever I kept my body active, I never kept on getting sick and so on. So what I can say is that lack of trust, yes, for these tablets and so on. And also there is need to train us, because one thing I learned from the book Ministry of Healing, I learned that our bodies themselves have a mechanism of healing. So the best thing to do is actually, when it shows you that you're sweating too much, it's better you actually take hot water to even allow the body to sweat more, walk around, don't overdo it, but walk around, make sure that you even support the body. It is when it actually is dispelling the excess urea that is not supposed to be in the body, sitting in the sunshine, taking lots of water, nutrition. Like, they have always guided me with self-medication. So I thank you.
Okay, so you have a medical missionary in the house. Maybe
What
just
do you have to say
something
about that?
Oh,
That
sorry about
you-
that.
Maybe let my colleague first comment on what you have said.
Yes. So much of what you were saying was actually preventive, according to what you're saying. And yes, we have the spirit of prophecy to give us that guidance on how we can prevent disease. So now we are looking at when the disease is there, what do we do? Yes, most of the conventional medicines are just chemically got from the natural remedies that we have. The disadvantage that we have in natural remedies is that there's no full study of them. Yes, it can help you relieve the malaria, but what does it leave inside after it has relieved the malaria? That part we don't know. So when it comes to the conventional ones, at least it has been studied. We know if you take paracetamol, there are these dangers it is going to leave behind. As a physician, I weigh harm against benefit. And if the benefit outweighs the harm, I give my patient the drug. And then also warn them that when you're taking this drug, chances are high you're going to face A, B, C, D, E. So when that A, B, C, D, E comes, they are not surprised about it. And then also, it is a case by case. If both of you had headache and you came in and talked to the physician, whatever history she gives me can help me select a medicine to give her. However much both of you are presenting with a headache. I might give her paracetamol, then I might give you diclofenac, depending on what discussions we've had. But then for natural remedies, it works for everyone, everywhere, whatever time. Young and old, almost it is the same thing. So that information is lacking. But I'm not saying they are bad, just that we don't have full information on what they do in our bodies. Yes.
Yeah, also on that point, just a minute. Natural remedies are very good. Even when we are defining self-medication, in our definition, we said home remedies are included and natural what? Remedies. Self-medication is just you choosing to medicate yourself by yourself. Now, the example you've given, for example, of malaria, that is like a double-edged sword, in my opinion. I'm not saying this is what everyone thinks or this is what is right. This is my opinion. It is true that, for example, mululuza cures malaria. It is true that chigazi, I'm not sure if chigaji cures malaria. That one I won't say it's true. But just because you have a fever does not mean you have malaria. That is the problem with self-medication. Because I had a patient last week who said, I can't even walk. My legs are broken. I can't do anything. Malaria is going to kill me from the what? From the house. Then I asked her, how long have you had the malaria for? Then she told me 2 weeks. Is it possible to have malaria for 2 weeks? Anyone who has had malaria before, is that possible? Can you stay in your house for 2 weeks? You cannot. You will, malaria, proper malaria.
You cannot.
So, most times we assume we have malaria because we have a fever, we have general body weakness and general body pain. What if it is typhoid? When we did that test, the lady had typhoid, not malaria. But it was very hard to convince her that she doesn't have what? Malaria. So if this lady had taken anti-malarials Would she have been helped?
No.
No. She would have felt better because they would give her paracetamol with the anti-malaria so the fever and body pain would go down in the period she's taking the medicine. But then after that, we go back to our what? Our body pain, our weakness. Meanwhile, she's getting sicker and sicker, cooking food for children with typhoid. So, the danger with self-medication is you will assume you know the disease you have because the symptoms are usually similar to what you have had before. That is why when you talk to a doctor and they ask you, how long have you had them? For them, they can tell, this is not malaria, this is typhoid, or this is this, or this is this, or it's a viral infection. You get the difference, eh? So while we are assuming it's malaria, maybe it's a viral infection. Now, like for children, the child comes up with a very high fever all of a sudden. They are not coughing, but they have a fever and they are sleepy. They don't have flu. Then you say, now what is this? Maybe it's a bacterial infection or malaria. You go and buy cefixime, or you buy anti-malarials. But the child has a what? A viral infection. So self-medication is making you spend money, but you thought it was cheap. Not so. It is making you waste time, but you thought it was convenient and time-saving. Do you see what we are trying to? Okay.
So in other words, self-medication is a gamble. Because I can also self-medicate, and chances are high I get it right and get better. But then there's also a chance I might self-medicate and then mask the disease itself. Yes. Someone over there had a question?
Or something to say. Yes, please.
Maybe before I take the microphone to her, I don't know whether we shall reach there. In diagnostics or checkups, a woman can come when she has low abdominal pain. And maybe she gets cramps during her periods, and she has had this for a long period of time. But when it comes, she takes ibuprofen and it goes. But that one recurs every time. Now, she doesn't want to come for scan, but she always buys certain medicine. Maybe they gave her cefixime some time back. So until when she comes and I find an ovarian cyst, then they treat her and she gets better, even conceives. I mean, we need to add in the benefits of investigations, that they help your doctor to determine the dose of the medicine you're going to take. You know the severity. Like, for example, for women, you might be having either UTI or PID or an ovarian cyst or fibroids. Now, how will you tell the difference between those if you don't want to go for consultation? Because it is at consultation that your doctor will tell you, I will not do anything before you do this test. Then either you first go home and look for the money and do that test, or he treats you, or he doesn't treat you. And if you choose to treat yourself, you will treat a wrong disease, and you will suffer with your money, putting in money, you take wrong medication, you harm your body, and at last, you come back for the real scan when you have maybe a fatty liver. Because you have taken a lot of medicine and they have injured your what? Your liver. So it is for our own what? Benefit.
Okay, thank you so much, Elder.
There's a lady there.
Thank you so much, facilitators, for the good lesson of health. To me, I have two things to contribute here. One, the way that we escape to go to the hospital sometime is because there is corruption. You know, when you talk of corruption, there is also corruption of time. You can go and queue there a lot of time while somebody is out of the office, who is to serve you. You wait there for hours and hours. If I'm friendly to a certain doctor or at home I have a nurse or a doctor, I shall be prescribed by that one, then I get the medication, it has gone like that. it will now rescue time for me. And it will make me not to go those who are corrupt people there. Number two, the contribution I have here is about this, what we call plant medication. Plant medicine is very important. As our friend has said there about Sister White's advice about this, I think this is the best way of treating, because this modern medication has a side effect. And I think what happens is that, that one of plant medicine or medication or medicinal plant is very important, but the problem comes that is not professionalism, which means that it doesn't undergo through research. That's why it's ignored. It is like occult science, that the governments and the people professionally, they never mind about that. But this of medicine, because it's professional, that's why it undergoes research and the other things around. But if you compare with that one, for instance, hydrotherapy, it is something very important. And the other things are there, like nutrition. Nutrition also, if you eat avocado, you eat some fruits there, you get healed. There are some diseases which are healed through that. And there are other countries which are now aware of medicinal plants. They are making research on that. You know, these other modern medications, you find that the drugs have side effects. Why? They undergo through industries, and there are some chemicals which are put there to preserve that medicine. When you eat that, or you drink that, or whatever, you apply that one, you will find that you will get some cancers and other problems in your body. Yes, you will get healed, but still there will remain some contradictions of the drug inside you, and you will suffer later, not that particular time. So now I think we have the reason of learning more to know which is the best than for us to apply. But I think this which was advised by Sister White is the most important, because it's through God's power who revealed to Sister White that for the last days, this the medication will take place, which is the best one. I don't know how you can advise us on that.
Before we go further, this is a disclaimer. We have not said that natural medicines are bad. They are not bad. We are talking about self-medication. If you know a natural medicine practitioner who is able to diagnose your disease rightfully and prescribe for you a natural medicine, please take it, and it works. What we are talking about is someone choosing to use a medicine, whether it is natural or pharmaceutical, by themselves without proof that that medicine is treating the right disease. Are we together? So we are not saying use pharmaceuticals, disregard natural medicines, disregard herbal remedies or home remedies. They don't work, they are dangerous. No. We are saying, even if you are using the natural medicine or home remedies, have proof that you are treating the right what? The right disease or condition. That when I take Chigaji, it is treating this, because Chigaji treats what? This. So be sure you have disease this, then you take Chigaji. That is okay. What we are discouraging is thinking you have disease this, then you take Chigaji by yourself without the help of a professional. Are we together? Yes. Yes, please.
Thank you, medics. Sometimes we are discouraged by the previous prescriptions. I have a friend who was diagnosed with a PID, and she treated a PID for a whole year. Ngagenda in Zambia hospital, paying consultation fee, meeting specialists, into brackets, nga taona. Then this person nabanga Of course, we cannot do without Dr. Google. So she went and consulted from Dr. Google, and she found out something that has helped her up to now. Sometimes it is fear. Nga tulos and these people have treated me, they've prescribed this, but it is not working. So sometimes we go there because we want to get better. It is really hectic swallowing medicine on a daily basis. So we go for that, something that is going to stop us from swallowing. Thank you.
Okay.
Until it has gotten started, I can content.
Okay. So the reasons seem like they are similar, just phrased differently. Okay? So let my colleague pass through some of the reasons we may not have talked about shortly, then we go to the next thing. Eh?
Okay. We are going to come to you just briefly. So some of the reasons you've given us, yes, we had them here. And then just to mention those that we missed out on, one was when symptoms seem simple. For example, it's a headache. If I have a headache, I'll go for a painkiller and my headache will be relieved. But the other reasons for self-medication are boredom, more so in the youth. Someone is bored, then they will go and buy a stimulant to adjust their mood in a way. And then the other one is influencing your lifestyle. For example, you have a very busy work schedule, and then sleep is coming, but you don't want to sleep because you have deadlines to beat. So you take coffee just to keep you awake for some extra hours of time for you to finish whatever you're doing, and then you get that proposal submitted. Those are some that I can see here that we didn't mention of, but we should be aware of. Yes.
Yeah, then maybe also fear of stigma. We have realized it makes some people self-medicate because you feel like, I can't disclose this condition to the doctor. I want to assure you, they have seen everything, they know everything. Sometimes even when you lie about symptoms, we can tell what you want to say, yeah? And we give you the medicine that you need. So don't be embarrassed to disclose all the information to a healthcare professional, because they will help you and give you the right medicine and alleviate your your suffering. So don't fear stigmatization, then you don't come to the health center. Okay, going forward, because our time is almost over, we'll combine the last thing of dangers of self-medication and drug abuse together. Because self-medication leads to drug abuse, like we have already seen. Most of us have abused drugs at a certain point in one way or another. Drug abuse is when a drug is used for a different purpose than its intended purpose. From there, we can all see maybe we have already abused what? Drugs.
Maybe just a question. A question to the audience. If someone walked in and they told you, I'm taking Viagra, what comes to your mind?
Yes.
Erectile dysfunction.
Yes, erectile dysfunction. But do we know that the active drug in Viagra is to treat hypertension? Yes. So you can find a certain man whose doctor wrote for him Viagra to manage the hypertension, and then you feel like, this man is charging themselves in a way. So
actually, that is just a side effect of the drug. It's not its intended purpose. So people who buy that drug to treat erectile dysfunction are probably abusing the drug, especially if it has not been prescribed by a healthcare professional. Yeah, so when you use a drug for a purpose that is not intended for, or in high amounts than are needed, you're abusing that drug. Maybe what is a drug? A drug is any chemical substance that is not food, that when ingested produces a biological effect in your body. So whatever you take that is not food and changes something in your body, that is a drug. Even, sugar is food, but sugar is one of the most widely accepted and abused drugs that we have. Then a medicine is a substance used to treat cure, prevent, or diagnose a disease, or promote the well-being of a person. So drugs and medicines are different. Some of the most commonly abused drugs. Do you know them? We have, she said paracetamol, yes. Panadol, Yes, please.
Metro.
Everyone with a stomach ache, Flagyl. Flagyl. Even when we do medical camps, you have seen, someone comes, I'm just in payoka dose, in katwale waka, olubuto bwe lunaatuluma nga tukola ki? Nga tumirako. But is a stomach infection the only cause of stomach ache? No. Flagyl, Panadol.
Maybe just to talk about paracetamol in brief, commonly known as Panadol, is how many of us are aware of the dangers that Panadol can cause when we take it? Yes? So you can see the hands are fewer than the number that has actually taken paracetamol. Because we feel it is something easy, something simple to take, but it can actually cause one of the biggest adverse effects that are hard to treat, and that is liver damage. So you take your Panadol, then you go and you take coffee. That is a problem already. Then some of us take Panadol, then we go and take a burger. Or we take a burger first and then we take Panadol. That is a problem already for you. Then some of us take Panadol and at lunch, maybe actually first have lunch. You make your salads, you put some vinegar in the salads to make them so nice for you. Then you swallow your Panadol to manage whatever pain you have. That is also another big problem you're causing to yourself. So even those that we think are simple medicines for us to use actually have potential to cause big harm to our bodies.
Yes. We've not talked about amoxicillin, azithromycin, especially after COVID. I don't know, especially parents of young children. Azithromycin, Ibumex, parents, dexamethasone, also especially after COVID. Because they told you, Minayoka Dexa, now whenever you start, Dexa, anything Dexa, you start azithromycin, parents, babies, the baby gets a fever, you don't know how to regulate the dose, you get cetamol. You give them 5 meals. Parents, and like everyone.
Just something small. To the ladies in the house, I know family planning is common to us. And how many of us have taken amoxicillin when we are on whichever family planning method we are having? More so the oral contraceptive. You know, once I have a cough, I'll go and buy amoxicillin. But then you're forgetting you're taking an oral contraceptive. Then tomorrow you'll walk in and you say, but doctor, my menses are disturbed. I'm not understanding. I have pelvic pain. But it is like a simple, in quotes, amoxicillin that you are taking. Then there are those of us who take cotrimoxazole. That is Septrin. You have a cough, you take Septrin. Then before you know it, you walk in with a child or yourself with a burnt-like skin. We call it SJS, Stephen Jones syndrome. Your skin burns itself, literally. You get burns, and they are very hard to treat. But from the simple Septrin that we take. So it is always important and good culture for us to go see a qualified professional, disclose as much information to them as you can, so they can get you the right medication suitable for you as an individual. Yes.
Okay. We are going to look at some other commonly abused drugs here in Uganda. So the drugs, we have pharmaceuticals, then we have these drugs of pleasure. Alcohol, that one needs no explanation. That one we all know, because even some of us here, we saw when we were getting baptized, but somehow, somewhere, we abuse alcohol. Now, these days, I used to think these things don't reach Uganda. But this was a study done in Uganda, and we are abusing heroin. Opatumujawa, I don't know. But we are abusing heroin and opioids. Usually, here we are introduced to opioids through painkillers. But that is one of the hardest addictions to beat, if you can anyway. Some common opioids include like the oxycodones, Oxycontin. You've heard of those drugs?
We have codeine.
Codeine, cough syrup. Parents, the child coughs and coughs. Then you say, let me buy codeine. They stop coughing. There is a reason they don't give it to children a certain age and for a certain period. So the doctor tells you, give them for 2 days only. But your child has allergies and they are always coughing. What do? You give codeine and give and give and give and give. You're making them addicted to opioids. These things are hard to beat. It's one of the biggest epidemics right now in the States. Opioids, which you can introduce in something as simple as cough syrup.
Then for ladies, there is pethidine, more so for the cesarean mothers.
Yes.
So you feel the pain, you call doctor, pain, they give you a shot. But then, you're only supposed to get pethidine just the 12 hours after the cesarean section. But because for you feel the pain is a lot, you want the doctor to continue with that dose even for 2 to 3 days.
And it produces a very big high.
You're becoming addicted to the drug.
Yes, I think all of us know cannabis, marijuana. That one we don't have to talk about it. Then cocaine. Now, this one, I don't know. Parents, over we are giving children too much money because these drugs are abused by teenagers. I don't know where they are getting them from, but they are getting them. We have something called CAT. I'm sorry to say this is not to discriminate against a certain people, but this one came in with the refugees, and it's very common to them, but it has been introduced. It's like a chewable tobacco. Then we have, Cuba. These have nicotine in them. Then we have aviation fuel, paint thinners, things like, I don't know how we get these things sometimes. I don't want to find out.
Just to mention something, how many of us here take coffee?
Caffeine.
Just coffee, a cup of coffee.
Coffee, tea, Coca-Cola, sodas, basically, soft drinks.
Yes, do you know that just that small 10 ml cup of coffee is equivalent to someone who has taken a tablet of cocaine? So when you mention cocaine, you cringe. You're like, hey, how could they? But when you're taking your cup of coffee, and the two of you are taking something similar in your bodies.
It affects the same areas in your brain. So while you're not taking cocaine, you're activating the same area in your brain when you take what? Coffee or tea or soft drinks with high doses of what? Caffeine.
And there is a common drug. Parents who have teenagers or campus goers, there's a drug that campusers know and they take. When you have that hard paper and you're reading things and your memory is just losing whatever you're reading, there's a drug they buy for memory retention. So they go buy, they consume as much knowledge as they can. They go sit for the paper, they come out with the A. And as a parent, you're happy. But then your child is becoming addicted to a drug. So we need to be very observant and watchful of our children, even ourselves.
So who are the most likely to use drugs and why and which ones? We have young people because some of them are homeless, because of familial abuse and sexual violence in our homes and exploitation, because we have school and societal pressure, parents who want 4, you want 8 in 8, you want 20 points for pleasure. And the drugs that youth normally take, because I think they are not as expensive, we have aviation fuel, we have glue, they sniff glue, paint thinners, marijuana, alcohol, caffeine, nicotine, and Adderall, the one she was talking about, so that they get good grades, because we want good grades. Then, men are likely to abuse drugs than women. Why? Because they say they are dealing with a lot.
Yeah, stressed.
Yeah. And the drug they commonly abuse is alcohol, but the trends are changing. We are also drinking a lot these days as women. Then some people, because of the way their society is now like refugees, they are dealing with a lot of trauma. You want to forget things, you take drugs. Then some professions are very stressful. For example, people like lawyers, doctors, the occupation is so stressful, and some of them have ready access to these drugs. So they are more likely to abuse the drugs. Then, because our time is almost up, some of the causes of drug abuse. We have a family history of addiction. So if, as a parent, you're abusing drugs, chances are high your children are going to do what? Abuse drugs. Then it has been discovered that most people with mental health disorders abuse drugs not because they want to abuse them, but because they want to quiet their minds. So because you can't really deal with what's going on in your head, they take maybe depressants like Xanax. You've heard of people, Xanax we give to people about pressure, and maybe mood disorders and stuff. Then because for you have heard, you also go and buy a Xanax, so that you can calm down. Then peer pressure, then lack of family involvement, especially for young people, and loneliness can make people do drugs.
Drug abuse.
Then being introduced to these substances early can make people abuse the drugs. Being exposed to highly addictive pharmaceuticals, like we've said, for people who have dealt with pain before, when they give you a good painkiller, usually it's an opioid, it takes away the pain, but it also makes you happy. So you'll probably abuse it. Then some people do to experiment, to feel good. Then others do drugs because of exposure to violence. So to deal with that violence. My friend is going to tell us, in conclusion, the dangers of self-medication and drug abuse, and then how we can prevent drug abuse and self-medication, what to do about it. Yes, please.
Okay, thank you so much. So some of the dangers, we've already seen and mentioned them. One is incorrect diagnosis. Because you have a symptom A, for you think it is disease B. It in actual sense, it could be disease Y. So you face incorrect diagnosis. Then there is delay in seeking medical advice. Because when you take that paracetamol, your headache is relieved, so it prevents you from going to the hospital. And before you know it, it gets worse. So by the time you come to the health facility, you're worse off than you were before. Then there is severe adverse reactions, like I've mentioned. Then there is incorrect dose. You can have a drug treating different conditions, but at different doses. So if you're doing self-medication, that information is not available to you. So you can take a dose which is not adequate to manage the condition you're facing. And then we have masking of a severe condition. You have a headache, probably have a brain tumor, and before you think it's a simple headache, you take an analgesic, you feel better, you continue with your life. Then, when you come to the facility later on, it has already progressed to a stage that we cannot handle. Then, there's incorrect manner of administration. I sometimes had an encounter with a patient who was given suppositories, and they didn't know how to take the suppository or to use it. So they come back to ask, good enough they came back, and said, Musao, kana katunga kanene ngenda kamira antya? And I told them, no, it's not for swallowing. It is actually to use in this manner. So if you do self-medication, chances are high, you'll miss out on that information. And then, of course, we've talked about the potential for addiction. Some of these drugs that we want to take, we do not know the side effects that they can cause, and which the most dangerous of them all is addiction. Addiction becomes expensive. Because each time you have some little money on you, you want to have this thing in your pockets. But now that we've learned of the dangers, how can we then help ourselves prevent self-medication? One, at national level, we can come up with regulations good enough to prevent someone from simply dispensing a particular medication to a patient. There is sensitization of the public, like we've had this today. I believe those of us who have had this information will have a changed lifestyle. Then, increasing accessibility to health care. government has levels of healthcare from health center to specialized hospitals. So if you're not comfortable, just walk in, they give you a prescription, then go buy from your favorite pharmacy. Then disclose as much information to your doctor as possible. Keep medicines away from children because you might cause an addicted child. Then, if possible, have a one pharmacy and a one doctor that is easy for you to access. One, for traceability, but also two, the more interactions we have, the more I learn about you. So when you walk in, I already have that information about you, so it's easy for me to give you a drug that actually works for you. And then follow your doctor's instructions to the letter. Most of us, when they are given instructions, we do as we wish, not as we were told. So I hope that we shall follow the instructions. And if we know of anyone who is addicted or is facing addictions, please link them to a therapist so that they can help them manage and then they get better. You cannot beat addiction by yourself. You always need help of a health care profession. Yes, so in conclusion, we are going to open Daniel chapter 1, verse 8. Daniel 1:8. To paraphrase, it says, when Daniel, of course, was faced with whatever the king had given them to eat, he purposed in his heart not to defile his body. So I hope even us who have learned this message, we shall purpose not to defile our bodies with what we know is wrong. And Ellen White, in Counsels to Church Temperance and Bible Hygiene, she quotes and says, just a minute. So for our friends who are talking about Ellen White, we are going to hear what she says. She says that there is a work for us to do, stern and earnest work. All our habits, tastes, and inclinations must be educated in harmony with the laws of life and laws of health. By this means, we may secure the very best physical conditions and have mental clearness to discern between the evil and good. So let us all purpose to keep healthy. Thank you for listening.
Thank you so much for being an interactive audience. We pray that we have all learned something, and may God bless us as we go into the next session.
What do we say, church? Would like to thank our doctors. Our doctors from, they come all the way from Mount Zion. I see Mount Zion has a very, very strong team of doctors who are going to guide our church regarding their health. Thank you, Dr. Jovio Watisa and Dr. Zalwango for that presentation. You have really opened our eyes to choose rightly. Right at this moment, I want to drive you very fast to the next program. We shall have our break right after this presentation. It will be for 5 minutes. I want us to go to divine service quite early so that we hit the time. We don't need to encroach on the afternoon program. This is a communication from CUC by Pastor Perez. I see he has our guests. They may be like coming from where you know, but they're representing Central Uganda Conference. I'd like to thank you, Pastor Perez, and your team for coming.